This is a natural dietary supplement extract from tropical sorghum biocolor, researched, refined and confirmed as a powerful antioxidant.
Yeah, you see, Otoba has said it all. 1995 they discovered Jobelyn, Jubi formula, which is the forerunner of Jobelyn. 1998 I was already on the bandwagon. The fact is that if you look at what Jobelyn was doing, it would attract the attention of any medical practitioner. Jobelyn enhanced the quality of blood. Blood is taken to be the liquid, the fluid of life. When blood is drained from anybody, that's the end of life. And here was something, herbal, simple to take. You just drank it, that was the crude form, you drank it, and your packed cell volume, the quality of your blood rose back to normal in a very short time. Of course, that's why I went to attack Otumba of having made such a statement, even not being in the forerunner of medical practice. He could make such a statement, and here I am today promoting that same thing that I went to disqualify. Now, let me just draw your attention to something. Medical science, whatever you may be practicing, is based on improving, 1, the quality of your blood, 2, reducing oxidation, 3, reducing too much of inflammation. And finally, these are the 3 things we have discovered that Jobelyn does. But let me start by saying what dragged me into joining the bandwagon of Jobelyn. I went to attack him. He was a very, very, very nice gentleman. He did not quarrel with me, even though I went to quarrel with him in his office. He simply gave me a keg of Jubi formula, which I took back to my hospital. And within about under 2 weeks, I met a woman who came with her debilitated daughter, who was a sickle cell disordered child, who had just undergone crisis, who had become very, very anemic, and was at the point of death. Let me repeat, at the point of death. The hemoglobin was 2.9. At school, we were taught to transfuse at hemoglobin of 6. But here was a 5-year-old child with a hemoglobin of 2.9, near to death, who happened to be a Jehovah's Witness. You know what Jehovah's Witnesses do? They don't take blood. And I gave this Jubi formula liquid to this child, and within 11 days, the hemoglobin value had increased to 5.3. To me, it was a miracle reenacted. And from then, I became an apostle of Jobelyn. That was just the beginning. Ever since then, we have operated Jehovah's Witnesses with hemoglobin of 4, below 5, without blood, and we just giving Jobelyn. We have done so many other things. But quickly, let me tell you what benefits, enhancement, what really attracted me to Jobelyn. I took a little note here that, for example, sickle cell disease people, if you have too much of malaria, your red blood cells are depleted, you need Jobelyn, you need to increase your hemoglobin level. Before surgery, if you don't want to take blood, you have to increase your hemoglobin. When you do dialysis, when you have kidney problem, you do dialysis, your hemoglobin drops. Imagine you don't have the money to buy blood. After serious septic conditions, people bleed before, during, and after delivery. Imagine you don't have the money to take a blood transfusion. You need blood. HIV patients, most of them having gone through series of opportunistic infections, often die because of insufficient quality of blood, what we call anemia of opportunistic infections. Like I have said, Jehovah's Witnesses, they don't take blood transfusion. Imagine they were to be in conditions that require blood transfusion, and they don't have money to buy. There is one injection they call Epogene, that is synthetic erythropoietin. What do they do? And of course, the sickle cell disease patients that I've talked about, who need transfusion and are anemic and don't have the money to buy the necessary other medicines. What do? You will see that one of the most important things you have to do in medicine to keep patients alive is to make sure that the quality of their blood goes high and never goes down. And imagine having this simple to consume medicine. You don't need to give the injection, you don't need anything, you just swallow these tablets. Immediately, I fell in love with this Jobelyn. So it's no doubt at all that you find a surgeon forgetting about the usual procedures of having to go through 100 years research to confirm through clinical trials. I saw Jobelyn, I saw what Jobelyn did, and I fell in love, and ever since then, like I've said, I have become an apostle of Jobelyn.
Jobelyn now comes in a new pack.
Live healthy, live Jobelyn.